Hi, I'm Dr. Dean van Westhuizen, an ophthalmologist in Mbombela, South Africa, and this is just a short video on corneal cross-linking. So corneal cross-linking is a procedure that is performed for patients with keratoconus. It is done for other reasons, but predominantly it's for keratoconus, and it's to stop progression. So just a brief reminder as to what keratoconus is. It's a condition of the cornea, so the front part of the eye. If you just to remind you of the basic anatomy, the front part of the eye is here. This is the cornea, so it's the clear lens essentially, which is right in front of the eye. And instead of it being round like this, it becomes more cone shaped. So I've got a diagram here that's quite useful to see. Here's a normal cornea, that's normal round. You can see this cornea has become thinner and steeper. So this is what we would call keratoconus. Kerato means cornea, conus means cone, so keratoconus is a cone-shaped cornea. Which you can see in this diagram over here. Now, keratoconus can be a progressive condition, meaning that the cornea gets thinner and steeper. So that's what we monitor. Each time a patient comes back, is the cornea thinner? Is it steeper? And as it gets worse, the vision obviously deteriorates. But fortunately, with the advent of cross-linking, we are able to, for the most part, stop the progression. So if we see that a cornea is continuing to progress, we will suggest doing corneal cross-linking. So what does that mean, to cross-link the cornea? And normally a sponge or something just to wipe those cells off the surface. The reason we remove those cells is to allow the eye drops, which are a riboflavin, which is a type of eye drop that we place on the cornea, to go into the cornea itself. They're these bright yellow drops, as you can see here. This is the riboflavin drops being placed onto the surface of the cornea, and we normally soak the cornea until the stroma, which is the central layers of the cornea, they've absorbed that riboflavin drops. That normally takes about half an hour to 45 minutes. So that's the initial part of the procedure. A speculum is placed in the eye to hold your eye open. Local anesthetic drops are placed so that your eye is numb. It's not an uncomfortable procedure at the time of the procedure. And then eye drops are placed normally in about 5-minute intervals until the cornea is completely soaked with riboflavin drops. Once we are happy that the cornea is completely soaked, we then apply an ultraviolet light. So here's an example. You can see here's the speculum in the eye. This has already been soaked in riboflavin, and this light source over here, which is an ultraviolet light, it gets placed onto the eye. Here's a slightly close-up look of what that looks like. It often has this luminous yellow-green glow when we perform it. And this light, depending on the protocol used, there's different protocols, normally between 10 and 15 minutes, up to 30 minutes, depending on the light that's used and the protocol that's used for it. After the procedure, a contact lens is placed on the eye because your eye can be very uncomfortable where those epithelial cells have been removed. And so the first few days after this procedure, the eye can be quite uncomfortable. The contact lens we place on the eye helps we call it a bandage contact lens because it is essentially like a bandage. It's not for vision, it's to help the eye feel more comfortable, less scratchy and irritated. But after the procedure, for a few days, it can be quite uncomfortable. We normally give some analgesia to help control some of the pain. Very occasionally, we may give 1 or 2 drops of local anesthetic. Now, a common question that patients have is, why can't I have local anesthetics? Because the local anesthetics drop numb the eye, that makes the eye feel completely painless. The drops firstly only last about 45 minutes and then they wear off, and so then you have to continually apply local anesthetic drops. And the problem with that is that local anesthetic is toxic to the epithelium, and if we've removed the epithelium and now you're placing drops on the eye that are toxic to the epithelium, the exact cells that we want to grow and cover that defect are inhibited, and that can be quite dangerous, can lead to chronic epithelial defects, can lead to infections and other issues. So unfortunately, local anesthetics are not something that can be prescribed afterwards, maybe 1 or 2 drops, but normally some analgesia, there's some other eye drops and lubricants that we normally suggest, and we remove that contact lens normally about 5 days later. By that stage, the epithelium is normally already grown in place, so it normally heals very quickly, and then we do follow-up after that. Basic pathophysiology is that your cornea, which is made up of collagen are made up of fibers, and those collagen fibers have crosslinks that help connect them together, that give them their tensile strength. And so what happens with cross-linking is the combination with riboflavin reacting with the ultraviolet light causes more of these cross-links to develop between the collagen fibers. And so that strengthens the cornea, prevents it from thinning, prevents it from getting steeper, and therefore stops the progression of keratoconus getting worse. Now, not every person can be cross-linked. There's certain criteria which we would need to discuss, or you need to discuss with your doctor. But it's important, if you have keratoconus, to be following up regularly, to be having corneal topography, which is mapping of the cornea, to check the steepness, to check how thick it is, and to control any other symptoms, especially eye rubbing. Eye rubbing is obviously one of the things that we know causes keratoconus to progress, so to control that as well. So that's the basics of what cross-linking is. It really is revolutionary in terms of keratoconic patients, where before we didn't really have anything that could stop the progression. And now, if we pick it up early and can do cross-linking, we can prevent a potentially blinding illness, or an illness that requires a variety of other forms of surgery before it's even required. So I hope that was helpful, and if you would like more information, please feel free to contact us.